Welcome to our deep dive into the world of fungal and parasitic infections. These infections are more common than you might think, affecting millions of people worldwide each year. From mild skin irritations to life-threatening diseases, fungi and parasites can impact our health in many ways. Today we'll explore what these infections are, how they spread, and why understanding them is crucial for everyone. Let's begin by clarifying the difference between fungal and parasitic infections, setting the stage for a journey through their hidden dangers and daily life impacts. Fungal infections are caused by fungi, which are organisms found almost everywhere in the environment. While many fungi are harmless, some can invade the human body and cause disease. Common examples include athlete's foot, ringworm, and yeast infections. These infections can affect the skin, nails, lungs, and even internal organs. Fungi thrive in warm, moist environments, making certain body areas more susceptible. Understanding how fungi operate helps us recognize the importance of hygiene and prevention in our daily routines. Let's take a closer look at some of the most common fungal infections. Athlete's foot is a well-known example, often affecting people who walk barefoot in damp areas like locker rooms. Ringworm, despite its name, is not caused by a worm but by fungus, leading to circular rashes on the skin. Yeast infections can occur in various parts of the body, including the mouth and genitals. These infections are usually treatable but can be persistent if not managed properly. Fungal infections can spread through direct contact with infected people, animals, or contaminated surfaces. Shared towels, shoes, or even floors can harbor fungal spores. Some fungi are airborne and can be inhaled, leading to respiratory infections. Maintaining good hygiene, keeping skin dry, and avoiding sharing personal items are simple yet effective ways to reduce the risk of infection. Being aware of how these infections spread helps us protect ourselves and those around us. Recognizing the symptoms of fungal infections is important for early treatment. Common signs include redness, itching, peeling skin, and sometimes a distinct odor. In more severe cases, there may be swelling, pain, or discharge. Fungal infections in the lungs can cause coughing and difficulty breathing. If you notice persistent symptoms, it's best to consult a healthcare professional for proper diagnosis and treatment. Most fungal infections can be treated with antifungal medications, which come in the form of creams, ointments, or pills. It's important to follow the treatment plan as prescribed, even if symptoms improve quickly, to ensure the infection is completely cleared. In some cases, especially with deeper or more persistent infections, longer treatment may be necessary. Keeping the affected area clean and dry also supports recovery. Prevention is always better than cure. To avoid fungal infections, practice good hygiene by washing your hands and feet regularly, wearing clean socks, and keeping skin dry. Avoid walking barefoot in public showers or locker rooms, and don't share personal items like towels or shoes. Simple habits like these can greatly reduce your risk of developing a fungal infection. Now let's shift our focus to parasitic infections. Parasites are organisms that live on or inside another organism, known as the host, and benefit at the host's expense. Parasitic infections can be caused by protozoa, helminth worms, or ectoparasites like lice and mites. These infections can affect various parts of the body, including the intestines, blood, and skin. Understanding the types of parasites helps us recognize the wide range of diseases they can cause. Parasitic infections are generally grouped into three main categories: protozoan, helminthic, and ectoparasitic. Protozoan infections like malaria and giardiasis are caused by single-celled organisms. Helminthic infections involve worms such as roundworms, tapeworms, and flukes. Ectoparasitic infections are caused by organisms like lice, fleas, and mites that live on the skin. Each type has its own unique way of infecting and affecting the human body. Parasites can enter the human body in various ways. Some are transmitted through contaminated food or water, while others are spread by insect bites or direct contact with infected individuals or animals. Poor sanitation and hygiene increase the risk of parasitic infections. Once inside the body, parasites can multiply and cause a range of symptoms, depending on the type and location of the infection. Symptoms of parasitic infections can vary widely. Some people may experience digestive issues like diarrhea, abdominal pain, and nausea, while others might have skin rashes, itching, or fever. In severe cases, parasites can cause anemia, weight loss, or organ damage. Because symptoms often resemble other illnesses, parasitic infections can sometimes go undiagnosed for a long time. Diagnosing a parasitic infection usually involves a combination of medical history, physical examination, and laboratory tests. Stool samples, blood tests, or skin scrapings may be analyzed to identify the specific parasite. Early diagnosis is important for effective treatment and to prevent complications. If you suspect a parasitic infection, seeking medical advice is always the best course of action. Treatment for parasitic infections depends on the type of parasite involved. Antiparasitic medications are commonly used and may be given as pills, creams, or injections. In some cases, additional treatments are needed to address complications or symptoms. It's important to complete the full course of medication to ensure the parasite is completely eliminated from the body. Prevention strategies for parasitic infections focus on good hygiene, safe food and water practices, and avoiding contact with known sources of infection. Washing hands before eating, drinking clean water, and cooking food thoroughly are simple yet effective measures. In areas where parasites are common, using insect repellent and sleeping under mosquito nets can also help reduce risk. While both fungal and parasitic infections can cause significant health problems, they differ in their causes, symptoms, and treatments. Fungal infections are caused by fungi, while parasitic infections are caused by organisms that live off a host. Understanding these differences helps in choosing the right prevention and treatment strategies for each type of infection. Certain groups of people are more vulnerable to fungal and parasitic infections. These include young children, the elderly, people with weakened immune systems, and those living in crowded or unsanitary conditions. Travelers to regions where these infections are common should also take extra precautions. Being aware of your risk factors can help you take steps to protect your health. Fungal infections can occur in everyday settings, from gyms and swimming pools to your own home. Moist environments such as bathrooms and kitchens are ideal breeding grounds for fungi. Regular cleaning, proper ventilation, and personal hygiene can help keep these infections at bay. Being mindful of your surroundings and habits is key to prevention. Traveling to new places can expose you to unfamiliar parasites. Drinking untreated water, eating raw or undercooked food, and insect bites are common ways travelers get infected. Researching your destination, getting recommended vaccines, and practicing safe food and water habits can make your trip safer and healthier. Pets can sometimes carry fungi or parasites that infect humans. Regular veterinary care, proper pet hygiene, and washing hands after handling animals are important steps to reduce this risk. Teaching children how to safely interact with pets also helps prevent infections in the household. Hospitals and healthcare settings can be hotspots for fungal infections, especially for patients with weakened immune systems. Strict hygiene protocols, sterilization of equipment, and prompt treatment of infections are essential to prevent outbreaks. Healthcare workers play a vital role in maintaining a safe environment for everyone. Children are particularly susceptible to parasitic infections due to their developing immune systems and frequent hand-to-mouth contact. Common infections include pinworm and head lice. Teaching children about hand washing, keeping fingernails short, and regular screening in schools can help prevent the spread of these infections. Environmental conditions play a significant role in the spread of fungal and parasitic infections. Warm, humid climates favor the growth of fungi and the survival of many parasites. Floods, poor sanitation, and overcrowded living conditions can increase the risk of outbreaks. Addressing environmental factors is a key part of public health strategies. A strong immune system is our best defense against fungal infections. People with weakened immunity, such as those with HIV/AIDS, cancer, or on immunosuppressive drugs, are at higher risk. Eating a balanced diet, getting enough sleep, and managing stress can help support immune health and reduce susceptibility to infections. Parasitic infections can impact nutrition by causing malabsorption, loss of appetite, and nutrient deficiencies. Children with chronic parasitic infections may experience stunted growth and developmental delays. Addressing these infections promptly and ensuring a nutritious diet are important for recovery and long-term health. Fungi don't just affect humans, they also impact agriculture by infecting crops and livestock. Some fungal infections can contaminate food supplies, leading to economic losses and food insecurity. Farmers use various methods, including fungicides and crop rotation, to manage these risks and protect food production. Livestock are also vulnerable to parasitic infections, which can reduce productivity and spread to humans through food or direct contact. Regular veterinary care, deworming, and proper animal husbandry are essential for keeping animals healthy and preventing transmission to people. Fungal and parasitic infections are a global health concern, particularly in developing countries where access to clean water, sanitation, and healthcare may be limited. These infections contribute to significant illness, disability, and even death worldwide. International efforts focus on improving public health infrastructure and education to reduce the burden of these diseases. One growing challenge is drug resistance. Some fungi and parasites have developed resistance to commonly used medications, making infections harder to treat. This highlights the importance of using medications responsibly and supporting research into new treatments. Preventing infection in the first place is also more important than ever. Vaccines play a crucial role in preventing some parasitic infections such as malaria. While there are currently no vaccines for most fungal infections, research is ongoing. Vaccination, combined with other preventive measures, can significantly reduce the risk of infection and improve public health outcomes. Good personal hygiene is one of the simplest and most effective ways to prevent both fungal and parasitic infections. Regular hand washing, bathing, and keeping living spaces clean can make a big difference. Teaching these habits to children and practicing them consistently helps protect the whole family. Safe food handling is key to preventing many infections. Wash fruits and vegetables thoroughly, cook meat to safe temperatures, and avoid consuming raw or undercooked foods. Store food properly and be mindful of expiration dates. These simple steps can help keep you and your family safe from foodborne fungi and parasites. Contaminated water is a major source of parasitic infections. Always drink water from safe, clean sources. In areas where water safety is uncertain, boil water or use filters before drinking. Avoid swallowing water when swimming in lakes or rivers, as these can harbor parasites. Wearing appropriate clothing can help prevent both fungal and parasitic infections. For example, wearing shoes in public showers protects against athlete's foot, while long sleeves and pants can reduce insect bites. Choosing breathable fabrics also helps keep skin dry and less prone to fungal growth. Community health programs play a vital role in controlling fungal and parasitic infections. These initiatives may include public education, mass deworming campaigns, and improving sanitation infrastructure. Working together as a community helps protect everyone and reduces the spread of infections. Healthcare workers are on the front lines of infection prevention and treatment. Their expertise in diagnosing, treating, and educating patients is invaluable. Supporting healthcare workers with proper training and resources ensures better outcomes for individuals and communities alike. There are many myths and misconceptions about fungal and parasitic infections. Some people believe only those with poor hygiene get infected, but anyone can be at risk. Others think these infections are always easy to treat, which isn't true. Understanding the facts helps us take the right precautions and seek timely treatment. Some people develop allergies to fungi, especially mold, which can trigger respiratory symptoms like sneezing, coughing, and asthma attacks. Keeping indoor environments dry and well ventilated helps reduce mold growth and related health issues. If you have allergies, consider using air purifiers and cleaning regularly. New fungal and parasitic infections are emerging due to changes in climate, travel, and human behavior. Monitoring these trends and adapting public health strategies is essential for staying ahead of potential outbreaks. Ongoing research and surveillance help identify and respond to new threats quickly. People with chronic illnesses such as diabetes or lung disease are more susceptible to fungal infections. Managing underlying health conditions and following medical advice can help reduce the risk. Regular checkups and early intervention are important for maintaining overall health. Pregnant women are at higher risk for certain parasitic infections which can affect both mother and baby. Prenatal care, safe food and water practices, and avoiding exposure to known sources of infection are important steps for a healthy pregnancy. Consult your healthcare provider for specific recommendations. Certain workplaces, such as farms, construction sites, and healthcare facilities, may have higher risks for fungal infections. Wearing protective clothing, following safety protocols, and maintaining clean work environments are important preventive measures. Employers should provide training and resources to keep workers safe. Travel medicine specialists can provide valuable advice on preventing parasitic infections when visiting high-risk areas. They may recommend vaccines, medications, or specific precautions based on your destination. Planning ahead and following expert guidance can help ensure a safe and healthy trip. Early detection of fungal and parasitic infections leads to better outcomes and reduces the risk of complications. Regular health checkups, awareness of symptoms, and prompt medical attention are key. Don't ignore persistent or unusual symptoms. Early action can make all the difference. Some people may live with chronic fungal or parasitic infections that require ongoing management. This can include regular medication, lifestyle adjustments, and frequent medical monitoring. Support from healthcare providers, family, and community resources can make living with these conditions more manageable. In summary, fungal and parasitic infections are widespread and can affect anyone, but with the right knowledge and habits, they are largely preventable and treatable. Practicing good hygiene, being aware of risk factors, and seeking medical care when needed are the best ways to protect yourself and your loved ones. Stay informed, stay healthy, and remember that prevention is always better than cure.